Hello, my name is Carmen Poli, and today I'm going to talk to you about how to improve healthcare transparency all over the United States. One of the problems we have is security. In 1999, the Institute of Medicine reported on preventing errors. Let me tell you a couple of errors that occurred. One of the errors were medication mix-up, which happens a lot. We also have infections. We have wrong diagnosis. Very easy to happen. And we have one of the most ugliest ones is unnecessary surgeries. So, making that one of our problems is where we want to improve our health care so that our errors become less. And now, how do we do that, you ask yourself? This is how we do that. Us, as healthcare administrators, we must have our doctors, our nurses, our employees trust us, learn how to document all of their errors, have a error system, and document all the errors so that we're in that error system that will show throughout the hospital or clinics the error that occurred so that it doesn't happen again. And not to point fingers, but just so that we can all learn from our mistakes. That is how we do that. So we must be effective. We must learn how to report effectively, accordingly, and they need to come to us as administrators. Another transparency to be improved in the healthcare system is billing. Billing is a big one. We must have a relationship with our third-party vendors. They must have confidence and trust in our facilities, that we are not billing incorrectly, that we're billing for the right items, so that we can have that relationship and we can have more business and more of the third parties are willing to open up to us and let us be part of their network. If not, we are going to be locked out of the network. That is very important. And how do we do that? By talking and billing correctly and making sure that the audits are correct when they do an audit. And everything is paper. Everything is a paper trail these days, electronically and manually. We have to track everything. And this is how we do these things so that we can be a better healthcare system to take care of our patients, our doctors, our nurses, and our employees. That's very important to do. So it is very crucial that we as managers and administrators instill in our employees that not to be afraid to talk to us, address us, let us know what's going on, show them how to use the error reporting systems so that they can report and they can talk to they can report and write down everything that they need to write, whether it be dispensed the wrong medication, dispensed the wrong dose, what have you. It needs to be done so that we become a better healthcare and we become united as one.